And today I'll be recording this presentation on behalf of Dr. Chamaki from Nigeria on the topic of opposed mandatory genetic screening. So to begin, I'd like to highlight the significant impact genetic diseases have on our healthcare. These conditions aren't just rare anomalies, they account for a substantial portion of the overall disease burden. In fact, it's estimated that nearly 8% of individuals under the age of 25 are affected by a genetic disorder. Even more striking, around 30% of pediatric hospital admissions are linked to genetic abnormalities. These numbers make it clear that genetic component of disease isn't a niche concern, it's a major factor shaping the demands and challenges faced by modern healthcare systems. Start by defining what genetic testing actually is. Genetic testing is a medical tool used to identify changes in our chromosomes, genes, or proteins that result from abnormalities in our genetic makeup. In simpler terms, it helps us detect errors in the body's instruction manual. This type of testing plays a vital role in either confirming or ruling out a suspected genetic condition. It can also help determine a person's risk of developing a genetic disorder or passing it to their children. Today, there are over 1,000 different genetic tests available. This includes molecular genetic tests, which look at single genes or short lengths of DNA, chromosomal genetic tests, which examine whole chromosomes or long stretches of DNA, and biochemical genetic tests, which assess the activity of proteins and enzymes in the body. Now, let's take a look at some of the key arguments in favor of genetic testing. First, genetic testing enables early detection and prevention. By identifying a genetic risk before symptoms appear, we can take proactive steps, whether through lifestyle changes, regular monitoring, or early interventions to reduce the impact of a disease or even prevent it entirely. Second, it paves the way for personalized medicine. With insights from a person's genetic profile, healthcare providers can tailor treatments that are more effective and have fewer side effects, moving away from a one-size-fits-all approach. Finally, genetic testing play a crucial role in family planning, genetic counseling. For couples, especially those with a family history of genetic conditions, this information can guide informed decisions about having children and help prepare for any potential health challenges in advance. So, while genetic testing offers clear advantages, it's important to recognize that it's not without concerns. Yes, genetic testing is beneficial, but only to a certain extent, and several key ethical considerations must be kept in mind. First, the issue of privacy. Genetic information is deeply personal, and there must be strict safeguards in place to protect it. Second, the real risk of discrimination. For example, employment or insurance based on someone's genetic predisposition, even if they are currently healthy. Third, confidentiality must be upheld. Only authorized professionals should have access to genetic results, and the patient should have full control over who sees their information. In summary, while the value of genetic screening is undeniable, we must ensure that it's done responsibly, always with respect for individuals' right, autonomy, and dignity. In conclusion, while genetic screening holds great promise in advancing healthcare, we must also carefully consider its potential negative impact on patients. It's essential that genetic screening be approached with sensitivity and caution, always upholding the core ethical principles of medical practices, including autonomy, privacy, and informed consent. We must not overlook the social and psychological effects that test results can have on individuals and their families. Fear, anxiety, and stigma are real risks that need to be managed with care and support. Ultimately, genetic screening is a valuable tool, but only that must be used responsibly and ethically, with the patient's well-being at the center of every decision. Thank you so much for listening to this presentation. For anyone who might have any questions.